So the type of cancer that I researched is non-Hodgkin lymphoma. It is a cancer of the lymphatic system. This particular kind starts in your white blood cells, which are called lymphocytes. Your risk factors can include age. If you're over 60, you're more likely to get this kind of cancer. If you're a man, you're more likely. And if your ethnicity is African American or Asian American, you're more likely to suffer from this. They're also finding that exposure to certain chemicals and drugs can be traced to this later on in life. It accounts for 4% of all the cancers in the United States, and there's approximately 77,000 new cases of non-Hodgkin lymphoma annually. Treatment can include chemotherapy, radiation therapy, stem cell transplants, and bone marrow stimulating medications. There is current research being done on vaccines. They're not like a typical vaccine that's given before you get a disease. You are given these vaccines if you're in the early stages of non-Hodgkin lymphoma, and it hopes to create an immune response that can help kill those cancer cells. And for prognosis, overall, there's a 72% survival rate after 5 years, but that also really depends on the stage of the cancer. So if it's just localized, it's just in one area, then you're going to have about a 73 5-year survival rate. If it's regional, so it's a little bit more spread out than localized, but it's not all over the body, it's going to be about 72%. And if it's distant all over the body, you have a 55% survival rate.